So whenever we adjust the neck, it's a very specific force and a technique to relieve pressure on the nerves. Now with Teresa, I like to adjust C1-2 right at the top here, because these nerve roots control all the muscle tissue in the head. It controls our sleep pattern, help regulate your hormonal response, and that helps us function better, especially sleep better. And Teresa, she's recently had a lot of tension on the right side here, and that can cause headaches coming up. So with adjustments, it's actually a very specific movement. It's actually quite a gentle movement as well. This is very, very isolated technique. We're going to fill into C1-2, and we're going to take a breath in, and then out, and adjust. And then on the other side, we can go a little bit lower into C2. Again, controls the muscle of the head. So we fill, we isolate, specific release, like that. And Teresa as well, I like to adjust the ankles. Teresa occasionally, because Teresa's a runner, occasionally she gets a little bit of ankle discomfort here. And a lot of this comes from all the ligaments around the ankle overworking. So we isolate, we fill, and pull. So isolate into the joint. And we're going to feel on Teresa L4-5, big nerve roots that come down the leg and into the muscles of the leg. So again, we're isolating the joint. L4-5 goes into your digestion as well. And we're just going to release pressure on the area. That's good. And we're going to go to the other side. And relax. One more time. That's good. Well done. Now we're going to go face down. So the tension here in the trapeze, all that is compensation from the neck joints here. It starts overworking and pulling the muscle fibers up. Now your mid-back works a lot with the neck, so when this gets very restricted, especially on these joints, T4 to T8, this controls your rib cage, the muscles going forward, also your diaphragm that we use to breathe deeper. So with Teresa, we're going to isolate T4, T5, we're going to breathe out, just here. So very restricted. And then T8, so we can breathe deeper. I'm going to isolate the right SI joint. Teresa, because we get a lot of tension on that right L4-5 into the piriformis, we're going to get a little pull here on the right side. I'm going to turn out. And then we're going to distract. And you can often feel a big pop here in the hip joint.
Make me cooler.
Look at that, nice and even. And we double check. So adjust as well. But I want to put a bit of overpressure here. So I use an adjusting tool called the impulse. I isolate into the area and affirm. So there's a little bit of residue tension here in the muscle groups here on the trapeze, in the piriformis, and what's called the paraespinals of the lumbar. So now we're going to show you our specialist physio, Eduardo, working on these specific muscle groups and what he's looking for.
The vibrations machines that we have at Madrid Health are really powerful, and within minutes our work is done. Our main goal is to try to reduce all the tension within the soft tissue, muscles, ligaments, tendons. Usually we start here, the cervical spine, to try to reduce all that soreness that our patient has. And then slowly we can go down and work on the thoracic spine here in the paravertebral muscles. It's really important to ask the patient if they feel any pain or discomfort, and we can reduce the level of power. We can work together with our hands to try to make more pressure. Afterwards, we go directly to the lumbar spine and the SI joint, a really important place. Here we can increase the power because all the structures are bigger and stronger. Of course, we can introduce movement to try to gain range of motion in this joint. Very, very carefully. This is a critical area when our patient has low back pain or gluteus pain, like the piriforme syndrome. So here is a really good spot.
Oh, nice.
Does it hurt?
No, it's perfect.
Good. So we can combine the vibration machine and a stretch of the muscle. It works perfectly.
So in our clinic we have specialized benches that actually allow us to open up the joints after the adjustment session and percussion session. So what we can do afterwards to get a little bit more stretch on this area and help free up the nerve roots, we can apply what's called flexion distraction. So we have specific settings here, and ultimately what we're doing here, we're allowing this area here, the lower part, to move up and down at a specific 15 degrees angle, and allowing that this certain speed to take pressure off the joints here. It feels like a deep stretch. How does that feel, Teresa?
It is great.
This helps open this area. So imagine if you've got nerve discomfort and we've got pressure on this area coming down the legs into the muscle of the low back. After our adjustment and percussion session, we can open this area up.
Yeah, it feels great, especially when it goes down like
There's a
that.
deep stretch just here. Now sometimes alongside this we may apply an ice pack here or biofreeze just to ease some inflammation in the area as well, okay? And we combine that with our PhysiTrack rehabilitation exercises designed by Eduardo, so we can specifically get you better alongside our sessions.